Assalamu alaikum and greetings to everybody. Thank you for joining this session. I am Dr. Abdullah Khan and with me Mr. Ananda Rajagopal, Kulusalingam, Madam Bama Vivi Menon, Dr. Tan Ching Siang, Madam Pungulali Subramaniam and Selva Rubini Ramesh. Our research project was the formulation and evaluation of mucoadhesive gels of clarithromycin for the effective treatment of dental Introduction. The widespread oral diseases are periodontitis and gingivitis. Gingivitis is the inflammation of the soft tissue beside the teeth and it is the first stage of disease, whereas periodontitis is the inflammation of supporting tissues of the teeth, destruction of periodontal ligament and alveolar bone together with formation of periodontal pocket and gingival recession. Interaction between the inflammatory cells and microorganisms in the adjacent tissue of the teeth leads to disease. The reason of the destructed periodontium is from the enzymes and toxins which is released by the microorganisms. Clarithromycin, the drug which we used in formulation of this mucoadhesive gel, is a second generation macrolide antibiotic which is derived from erythromycin. It is a novel antibiotic with a methoxy group attached to the C6 position of erythromycin and eventually make it acid stable compared to the erythromycin's stability. It is active against both gram-positive and gram-negative bacteria. Due to its stability, clarithromycin is well absorbed and well tolerated compared to erythromycin. It is beneficial in the non-surgical treatment of chronic periodontitis and gingivitis. Variety of novel drug delivery inventions have been developed to deliver the drug to the targeted site. Mucoadhesive gels, what we prepared in this study, they have distinct advantages over other dosage forms, particularly when they have to be administered within the oral cavity. They can be used for both local and systemic effects. They improve the residence time of the drug due to adhesive nature. They enhance the bioavailability because oral administration for local or systemic effects within the oral cavity, the mucosal absorption prevents the first pass effect on various drugs. Ease of application, desired drug release by the manipulation of the dosage forms. The objective of the study was to prepare and evaluate mucoadhesive gels containing clarithromycin. The gels were the objective included the evaluation of gels for their pH, spreadability, and organoleptic properties using visual inspections, and spreadability, drug content, uniformity, or drug content of each of the gels prepared, in vitro drug release, and in vitro release kinetics of all prepared mucoadhesive gels for the clarithromycin base was used, which was obtained from SM Pharmaceuticals CADA. Polymers, hydroxypropyl methylcellulose, carbopol, sodium carboxymethylcellulose, chitosan were used, and acetic acid and sodium hydroxide was used for neutralizing chitosan and carbopol respectively. Propylene glycol was used to disperse the drug and together with ethanol, which were all available in the KPJUC laboratory. The basic equipments used were digital balance. Besides that, we have used a spectrophotometer for the absorbance of drug release, and pH meter, magnetic stirrer, diffusion cells for the diffusion studies, the release studies of the drug were used. Preparation of gel. Mucoadhesive gel formulations containing clarithromycin was prepared by using HPMC, chitosan, sodium carboxymethylcellulose, and carbopol. Accurately weighed amounts of the polymers were dispersed in water for sufficient time to swell, to allow the polymers to swell, and wherever required, the polymers were neutralized using appropriate agents. Clarithromycin dissolved using propylene glycol and ethanol. The dispersion of drug when blended with polymeric dispersions and was blended with the polymeric dispersions and kept in a sonicator for 20 minutes. Then the dispersions were allowed to equilibrate for at least 24 hours at room temperature for complete hydration. This is the combination of various formulations what we prepared. Actually, total 9 formulations were developed using a polymer composite. The final composition of the polymers, percentage of the polymers were 3%. As you can see that HPMC chitosan, HPMC sodium carboxymethylcellulose, HPMC carbopol were the 3 combinations used in appropriate ratios to make the final percentage of the polymers to 3%. F1 to F3 used HPMC chitosan. F4 to F6 we used HPMC and sodium CMC, and F7 to F9 we used HPMC and carbopol. Glycerin was used as humectant for the formulation of gels. at a constant percentage of 5%, and clarithromycin 1% was added on the gel formulations. Water was used. This is the calibration curve of clarithromycin in phosphate buffer 6.8, and this was obtained by using concentrations of 2, 4, 6, 8, and 10 mcg at 205 nanometer. Physical evaluation of the gels were performed for their color, homogeneity, consistency, and also we determined the pH, spreadability, and drug content of the formulated gels. Formulation F1 to F3 containing HPMC and chitosan, they showed slightly yellow color, whereas the homogeneity of all the formulations F1 to F9 was very good, and the color of F4 to F9, that is the combination of HPMC together with sodium CMC and carbopol, was white. Consistency was excellent. pH was between 6 to 7.2, which is acceptable for the application for the skin. Spreadability was least with formulation F3 containing HPMC and chitosan, whereas it was maximum for again the HPMC and chitosan at lower concentrations of polymers HPMC. Drug content uniformity was found to be above 95% in all formulations, exhibiting a very good dispersion of drug within the polymeric system. This is the appearance of the prepared gels. The gels, as we have discussed earlier, it is F1, F2, F3 showed slightly yellow color, whereas other formulations were clearly white. In vitro drug release was carried out using France diffusion cell, modified France diffusion cells, and this is the results of the in vitro drug release. We can see that formulation F1, F3, and F5 showed a bit of faster results, whereas other formulations, the drug release was sustained, and 50% of drug release was around at fifth hour, and only 80% of the drug was released at 6 hours. To establish the pattern of drug release and to establish the order of drug release, the results were subjected to best fit model fitting, and we have seen that all the formulations showed first order release, and also they subjected to this Higuchi and zero order, but Higuchi R values were closer to F1. Here we can see that F1 showed highest R square value for release. Similarly, here also F2 also showed the same highest value for first order, followed by Higuchi, and F3 also showed highest and 0.9862 for first order, whereas it was followed by Higuchi. R square values of F4 formulations, as we can see in first order, it was highest again, 0.9755, and it was 0.95 for zero order. Higuchi was found to be at 0.971. F5 also showed first order release kinetics at R square values of 0.9916, whereas for zero order the values were 0.94 only, and Higuchi it was 0.97. F6 formulation showed again first order release, and Higuchi was at 0.9. F7 also showed highest R square values of 0.98 for first order, followed by Higuchi 0.9861. It was highest for Higuchi for this particular formulation, and then we had zero order R square value was 0.9. F8 formulations showed very close values for Higuchi and first order, 0.98 for first order. And F9 finally also showed highest value for the first order with 0.98 R square values. Mucoadhesive gels containing clarithromycin were formulated using polymers such as HPMC, chitosan, sodium carboxymethyl cellulose, and carbopol as per the composition mentioned in table 1 previously. Chitosan with HPMC was used in F1, F2, and F3 formulations of mucoadhesive gels containing clarithromycin. Chitosan was considered as an excellent candidate to prepare mucoadhesive gels, which could be applicable on oral mucous membranes. The formulation prepared using chitosan with HPMC should sustain release of the drug due to the characteristics of both polymers, which exhibit hydrogel and biodiesel. Sodium CMC with HPMC was used in F4, F5, and 6 formulations of mucoadhesive gels containing clarithromycin to improve viscosity and for additive effect of mucoadhesive properties. Sodium CMC has an abundance of hydroxyl and ethyl groups along with along their length, which are responsible for the mucoadhesive properties. Increasing the concentration of the sodium CMC in the formulation increase in hydrogen bonding forming groups. This increase the mucoadhesive force of formulations, which may prolong residence time of the formulation at the site of application and may also sustain the release of the drug on the site of. Carbopol with HPMC was used in F7, F8, and F9 formulations of mucoadhesive gels containing clarithromycin, which have high molecular weight and swell in water up to 1,000 times of the original volume and therefore make large adhesive surface with the mucin and give good mucoadhesiveness. Carbopols form secondary bioadhesion bonds with mucin, while other polymers form superficial bioadhesion. Polymers that have mucoadhesive properties are used to improve the drug resistance time at targeted site of action. All the polymers used were contributed in bioadhesion as well as they used in control and sustain drug delivery through the gel formulations. Physical examination of color, homogeneity, and consistency was evaluated visually. pH measurement, spreadability, drug content uniformity, in vitro diffusion study, and kinetic studies were carried out to evaluate the properties of the formulated mucoadhesive gels. The formulated gels were visually examined for uniform appearance, absence of gritty particles, color, and consistency. Formulation F1, F2, and F3 appear to be slightly yellow in color due to the pale yellow color of the chitosan, whereas the other formulations containing HPMC, sodium carboxymethyl cellulose, and carbol are white in color and form clear and transparent gels. All the prepared formulations are homogeneous and free from gritty particles. These properties of the prepared gels make them organoleptically acceptable dosage forms, and which also enhance the patient compliance. Also, such properties of the gels make them more attractive compared to ointments and other semi-solid. Drug content is an important parameter to be evaluated for any dosage form to ensure the right amount of the drug is delivered for achieving desired therapeutic effects, and also to ensure the safe and effective concentrations are maintained throughout the duration of the therapy or before the administration of a repeating dose. The percentages of drug content were in the range of 97 to 99.5%, indicating a uniform distribution of drug in the formulations. F3 and F7 formulations drug content uniformity was the highest compared to other formulations, that is 99.5%. It showed that the concentrations were maintained throughout the formulation of the mucoadhesive gels containing clarithromycin. In vitro diffusion study of mucoadhesive gels containing clarithromycin was conducted for 6 hours. Phosphate buffer pH 6.8 was selected as medium to study the release of clarithromycin from the mucoadhesive gels. Various concentrations of polymers to the drug. This evaluation was done using modified Franz diffusion cell, and intermittently samples were syringed out and analyzed for the drug release by UV spectrophotometer at 20. Drug release from F3 for containing 1% HPMC and 2% chitosan was slower and provided the extended release profile. For F3, the time required for the release of 50% of total drug content was more than 5 hours, and the drug release was slower. The time taken for the 50% of drug content from F9, which contained 1% HPMC and 2% carbol, was 5 hours. It can be said that there was delayed drug release in formulation due to the drug entrapment in the polymeric matrix, and which retarded the release of the drug. The drug release is still a bit faster when compared to F3, which have slower release. For F7 containing 2% HPMC and 1% carbol, the time required for the 50% of total drug content was 2 hours. For the formulations F2, which contain 1.5% HPMC and 1.5% chitosan, F4 containing 2% HPMC and 1% sodium CMC, F5 containing 1.5% HPMC and 1.5% sodium CMC, and F8 containing 1.5% HPMC and 1.5% carbon. The time required for the release of 50% of the total drug content was more than 4 hours, and the drug release was slow, but when compared to F3, a bit faster. Even all the formulations have prolonged drug release, it would be expected that F3 and F9 would be potentially useful in the treatment of periodontitis. Moreover, the release of the drug is expected to be slower in the periodontal pocket. The overall studies, as part of conclusion, the overall studies indicated that F3 and F9 can retain drugs better compared to other formulations. Among the 9 formulations, the formulation F3 containing 1% HPMC and 2% chitosan, and F9 containing 1% HPMC and 2% carbol with clarithromycin as drug exhibited sustained and prolonged drug release due to the increasing the concentration of chitosan and carbol 2% and decreasing the concentration of HPMC to 1% could decrease the release rate due to increased viscosity of the formulation. Hence, it can be concluded that the formulation F3 and F9 will be useful as mucoadhesive gel for the treatment of periodontal diseases. So, the mucoadhesive gel containing clarithromycin may be a good choice to bypass the extensive hepatic first pass metabolism with improved, sustained, and controlled drug release through the oral mucosa from the formulated mucoadhesive gels of clarithromycin. That's all. Thank you very much for your concentration and listening. Any questions? I will be available online. Thank you.